Recognize the gentleman from Florida, Mr. Bilirakis, 5 minutes requested.
Thank you, Mr. Chairman. I appreciate it so much, and I thank the panel for their testimony today. Dr. Knabel, according to the Alzheimer's Association, more than 5 million Americans are living with this disease, with projections rising up to 16 million by 2050. How do these geriatric workforce programs integrate Alzheimer's disease and related dementias education to families and caregivers of older adults?
Well, thank you so much for that question. That we actually had an opportunity to have a separate addition onto our grant funding to actually address the Alzheimer's disease and related disorders education. How we're doing it, and I can give you that example from our program, is that we actually have partnered with the North Central Texas chapter of the Alzheimer's Association, in addition to a dementia-specific care center, in terms of delivering certain types of programs actually to patients and their caregivers. There's evidence-based programs. One's a stress-busting program. One is a REACH program where you actually are able to send in a dementia care specialist into the home to give the family member respite and also education. And so we are doing that collaboration with those programs and actually assisting them with some funding to expand the reach. We then also have our students as part of this so that then they can learn from this, and some of our residents, family medicine residents, are actually getting to get exposure to these programs. Another thing we're doing is, you know, now we have the Medicare annual wellness visit where you have to do screening for memory disorders. So what we're doing through our county hospital, and many people don't know how we got this to happen, and I probably shouldn't say it too loud because maybe they'll say don't do it, but basically what they're doing is we have an electronic health record at the county hospital called EPIC, and some of you may be familiar with that. So through the EPIC, we are now building platforms within it to be able to more adequately assess older adults, particularly those with cognitive impairment. We then make referrals to the community-based organizations such as Alzheimer's Association. They can now look at the EPIC platform. We are giving them access so they can see what's going on with that patient. They can then follow up. They can then reach out to the family to help them, and then they put notes in there about what they're providing to that patient and family, that then when the primary care doctor sees the patient back in the clinic, we see it. We close the loop between the primary care doctor, the referral to the community agency, and we make sure that patient and family is getting taken care of. So that's something we're doing out of our GWEP that I'm very excited about.
Can I ask you, when you said the welcome to Medicare, which actually my dad, Congressman Bilirakis, authored many years ago, so I want to brag about that.
You should.
A wonderful person. He's done an outstanding job over the years. But does that include the mental health screening? Is it required? Yes. It's required?
Yeah, well, we're adding in extra tools because this is a geriatric clinic that is out of our county hospital. So we're putting mental health for depression screen. We're doing fall risk assessments. We're doing basic assessments of daily living, instrumental of daily living. We're doing all those types of assessments as part of this. So there might be a patient that's determined to be a fall risk. We'll then refer them to the Senior Citizen Services, it's called 60 and Better, who does the congregate meal programs and actually provides the Matter of Balance classes. We would then have that person follow up. And again, they would have access to seeing the information.
How widespread is that throughout the United States, what you're doing?
It's not. Our hope is if you are reauthorizing, we can now apply to now take this out beyond Fort Worth, Texas.
Okay, thank you. Question for Dr. Billings. You and your colleagues are certainly no strangers to the growing shortage of medical professionals across the country, and someone probably has touched on this, but in your testimony you acknowledged the National Health Service Corps as an effective, even popular way to overcome the recruitment barrier for medical shortage areas. What other ways are stakeholders working together to recruit and retain medical talent in historically underserved areas, and why are they not as successful? and how can they be improved?
Sure, thank you for the question. So through the National Health Service Corps, there's a state loan repayment component where approximately, I believe, 37 states take advantage of federal money to utilize in states for state-specific needs that perhaps health professional shortage area scores don't go down low enough to fund because of the overwhelming need that is out there in the United States. Currently, there's only 10% of scholarship applicants are able to be funded every year, and only 40% of loan repayment applicants are currently funded. There's certainly a huge need, and there's interest by medical health students throughout the disciplines, and we are not meeting that need for the interest that that the students have that want to go into primary care, and we want to be able to enable that. The other huge need is, of course, we have about 10,000 field strength within the National Health Service Corps every year. To meet the need of the patients, the health centers, the critical access hospitals, the rural health clinics, the Bureau of Prisons, the Indian Health Service facilities, we need a field strength of 28,000 to meet the basic need of today. There's just a huge need. There's a lot of work to be done. And it's very, very important that we continue to support and enable these students that have expressed a desire to go out and serve the underserved, that we somehow enable them to be able to realize that dream and train them in that setting as well.
Okay, thank you. I yield back, Mr. Chairman. Thanks
Gentleman's
for
time has expired. The
scheduling
chair
this
recognizes the gentlelady from California.